Have you ever looked at your cat and noticed they seem to be slowing down a bit? Maybe they're hanging out at the water bowl more often. It's so easy to just chalk that up to them, getting older. But what if those little changes are actually tiny clues to a really serious hidden illness? Today, we're going to uncover one of the most common and sneakiest health problems in aging cats. Let's get into it.
So get this, a cat can lose up to 75% of its kidney function before we see any obvious signs of illness on the usual tests. That's huge. Think about it. 3/4 of their kidney function could be gone before we even know there's a problem. It's exactly why this disease is often called a silent stalker.
And this really leads to the big question that every single owner of an older cat needs to ask themselves. Our cats are absolute masters at hiding when they don't feel well. It's just what they do. So that means it's up to us to become masters at spotting the super subtle clues they might be sending. So what are we talking about here? It's chronic kidney disease, or CKD, and it is one of the most common reasons older cats get sick. The key word here is chronic. That means it develops really, really slowly, sometimes over months or even years. And that's what makes those first signs so incredibly easy to miss. Now, it's important to know there's a difference here. You've got acute kidney disease, which is like, bam, it happens fast, usually because of something specific, like if a cat eats a toxic lily. But chronic kidney disease, that's the one that just creeps up. It's more of a gradual wear and tear on the kidneys over time. And that's the one we're going to focus on. Okay, so how in the world do you spot a silent disease? Well, the good news is there are signs. They're just quiet. And this is where you, as the owner, become the single most important detective for your cat's health. Let's look at what you can actually see, right there in your own home. All right, these 5 signs are your main clues, and they're all connected. The increased thirst and peeing, that happens because the failing kidneys can't concentrate urine anymore, so your cat is losing way more water and has to drink a ton to keep up. That leads to a buildup of waste products in their blood, which basically acts like a poison. It makes them feel nauseous, so they don't want to eat, and they lose weight. Those same toxins make them feel tired and lethargic, and that weird ammonia-like breath, that's from waste building up. And finally, a cat that feels crummy often just stops grooming themselves, which is why their coat can start to look messy. If you remember nothing else, please remember these 2. These are often the very first signs you'll see. So just pay attention to the water bowl and the litter box. If your cat suddenly starts drinking and peeing a whole lot more, that's a huge signal. Getting in the habit of weighing them every so often can also catch that slow, gradual weight loss you might otherwise not notice. So, you've spotted some signs at home. The next step is a trip to the vet. Your observations are priceless, but to get a real diagnosis and figure out how serious it is, we need to do some specific tests to see what's going on inside. Your vet has a whole toolkit to figure this out. The classic blood tests look for waste products like creatinine and BUN that healthy kidneys would normally filter out. A urinalysis is so important because it can show if the urine is watery, a really early sign. They'll also check blood pressure and might even do an ultrasound to look at the kidney's size and shape. Each test gives us another piece of the puzzle. Now this is a total game changer. The sDMA test is newer, and it can flag a drop in kidney function way, way earlier than the old school tests. We're talking months or sometimes even years sooner. This test gives us the power of early detection, and when it comes to kidney disease, that is everything. And we can't forget about blood pressure. It's kind of a vicious cycle, really. Kidney disease can cause high blood pressure, and then that high blood pressure can cause even more damage to the kidneys. That's why regular checks, just like you see here, are so critical for any senior cat, but especially for one with CKD. Okay, hearing the words chronic kidney disease can be really scary. I get it. But here is the most important takeaway. While we can't cure it, we can absolutely manage it. The goal is to slow the disease down and, above all else, keep your cat feeling good and having a great quality of life for as long as possible. And the single most effective tool we have to do that? Diet. This isn't just about changing their food, this is medicine. Study after study has shown that a special prescription diet can seriously prolong a cat's life and make them feel so much better. It is the absolute cornerstone of managing this disease. So a great management plan is built on these 4 pillars. You've got the special diet, which is low in phosphorus and has controlled protein levels to ease the workload on the kidneys. Hydration is key, using water fountains or wet food, and sometimes even giving fluids under the skin at home. Then you have medications to help control blood pressure or nausea. And of course, regular checkups with your vet to make sure the plan is working and to make any little adjustments. All right, let's talk about the trickiest part. Getting a cat to actually eat the new food. This can be a huge challenge. The key is to be so patient. This can take weeks, not days. And here's a great tip. Instead of mixing the foods, try offering the new food in a separate bowl right next to the old one. And this is so important. Never, ever try to introduce a new diet when your cat is feeling sick. They'll blame the food for making them feel bad and might never touch it again. As we start to wrap up, I really want to come back to the main theme here. With a silent disease like CKD, your observation and your willingness to act early, that's the most powerful tool you have. It can completely change the outcome for your cat. One vet I know put it this way, and it really sticks with you. He said, it's not if cats get kidney problems, it's when. And that just underscores how incredibly common this is. The reality is, if a cat lives long enough, it's very likely to develop some level of kidney disease. It's why being vigilant is for all aging cats, not just the ones we think are sick. So, the bottom line is this. A diagnosis of CKD is not a death sentence, not at all. By catching it early and working with your vet on a solid, consistent plan, you can slow this disease way down and add not just months, but often years of happy, comfortable life for your best friend. Ultimately, it all comes down to this. Your cat depends on you. They can't tell you in words when they feel a little off or when they're nauseous. You are their advocate. So the real question is, are you watching closely enough to hear what they can't say?